Herniated intervertebral disc or ruptured disc. Herniation of the intervertebral disc is the protrusion of the nucleus of the disc into the annulus, that is fibrous ring around the disc, with subsequent nerve compression. The herniation may occur in any portion of the vertebral column. Pathophysiology and etiology. The intervertebral disc is a cartilaginous plate made up of gelatinous material in the center known as the nucleus pulposus and is encapsulated in the fibrous annulus. Risk factors for herniation include degeneration, that is aging, trauma, and congenital predisposition. Biochemical factors such as twisting and repetitive motions in occupational settings. Sedentary occupations, obesity, smoking. The third one, the herniation compresses the spinal nerve root on one side and with the further degeneration of the disc may eventually produce pressure on the spinal cord. This sequence may take months to years, producing acute and chronic symptoms. Clinical manifestations. General considerations. An intervertebral disc may herniate without causing symptoms. Symptoms depend on location, size, rate of development, and effect of surrounding structures. Most symptomatic disc herniations result in pain, sensory changes, loss of reflex, and muscle weakness that resolve without surgery. Cervical. If it is in cervical, pain and stiffness in the neck, top of shoulders, and region of the scapula. Pain in upper extremities and head. Paresthesias and numbness of upper extremities. Weakness of upper extremities. If it is in lumbar, low back pain with varying degrees of sensory and motor dysfunction. Pain radiating from low back into the buttocks and down the leg. Postural deformity of the lumbar spine. Positive straight leg raise test. Pain occurs in leg below the knee when leg is raised from a supine position. Weakness and asymmetric reflexes and sensory loss. Cauda equina syndrome is an emergency caused by compression of the cauda equina area of the spinal cord. Symptoms include bowel, bladder, and sexual dysfunction or saddle area numbness. It must be recognized early and compression must be relieved to prevent permanent loss of the above functions. Diagnostic evaluation. Myelogram demonstrates herniation and pressure on the spinal cord or nerve roots. CT or MRI demonstrates herniation. MRI has greater sensitivity. Electromyography localizes specific spinal nerve involvement. Management. Supportive measures. First one, conservative treatment 4 to 6 weeks if no progressive neurologic deficit. Second, bed rest on a firm mattress. 2 days usually sufficient. Third, heat or ice massage to affected area. Fourth, cervical collar, possibly cervical traction or widely used. Using efficacy is not proven. Fifth, physical therapy. Pharmacotherapy. Anti-inflammatory drugs such as ibuprofen and prednisone. Second, muscle relaxants such as diazepam or cyclobenzaprine. Third, analgesics, narcotics may be necessary during acute phase. Surgical intervention may be done if there is progression of neurologic deficit or failure to improve with conservative management. Surgical procedures include discectomy, decompression of the nerve root, laminectomy, spinal fusion, microdiscectomy, and percutaneous discectomy. DISKECTOMY, discectomy. Chemonucleolysis. Less common invasive treatment for lumbar disc herniation. Injection of chymopapine, CHYMOPAPAIN, pain into herniated disc that produces loss of water and proteoglycans from the disc, reducing the size of the disc and subsequent pressure on the nerve root. May cause severe complications such as transverse myelitis, allergic reactions, persistent muscle spasm. Alternative and complementary measures: acupuncture, manipulative therapy, massage therapy for adjacent pain and relief, homeopathic remedies, and various nutritional supplements. So management, 5 measures: supportive measures, pharmacotherapy, surgical intervention, chemonucleolysis, alternative and complementary measures. Complications: permanent neurologic dysfunction, that is weakness and numbness, chronic pain with associated psychosocial issues, Kada-Equina syndrome. And nursing interventions must include minimizing pain, maintaining mobility, community and home care considerations. Thank you.